Okay, so coming on to families then, what if you're in a situation where within a family where you have a mother, a father, a brother or sister who has attempted suicide, is at risk of suicide, and you're in the position of having to explain that to children of varying ages, say from between 2 and 10? What are some of the things that come up there?
So this is talking about somebody who's at risk, not somebody who's died.
This is somebody who is actually, let's start with that, somebody who is actually at risk and kind of trying to explain what's going on to a child.
Okay. Well, I think it's really important to, first of all, to realise that it's generally a good idea if children know things, because if there's commotion going on behind the scenes and all the adults are very tense and not behaving in their usual way, then kids know that something's up, and quite often what they imagine is far worse than the truth. So it's important that children have information. It's important that it's information that's appropriate for their developmental stage, though. It's a bit like talking about sex with children. To some extent, they really only you need to give them the appropriate, accurate information, but they'll come back to you later again and again and again because they didn't really process some of the stuff that they weren't ready to process. And it's a very similar thing. I mean, children have can have different ideas about death, for example, and the consequences of the end of life than adults do. So it's quite, to a child, it may be quite an abstract sort of thing, the idea of being at risk of suicide. I mean, that's, what does that mean? So you'd have to really be thoughtful about how much information you really tried to convey. So what I would do is I would talk about, I keep it very specific to the person who was at risk, and presumably the child would know that there were some issues. So how, I just say it was the dad, that dad's been feeling really, really sad lately, and it's a sadness that's a sickness, and he's been getting help from the doctor. But sometimes he feels so sad and sick that he feels that he can't go on anymore because it just feels too hard. And then when dad's feeling like that, then we need to do these certain things and maybe talk about what safety plan the family's got in place for taking care of the father, for example.
Okay.
And then the child can actually be sort of part of that, but without feeling. It's important to kids will tend to feel responsible. Kids feel that it's their fault that their parents' marriage broke up, that it's their fault that all sorts of things happen. It's quite important to make sure that the kids don't feel responsible for any outcome, but that they can participate, and in this family we look after each other, and this is what we're doing.
Picking up on that point then about safety plans within families, I mean, sometimes there can be a sense that in terms of a person's clinical care, it can vary. Sometimes someone isn't seeing the best doctor or the best professional, and the burden can come back on the family to support that person. So in a situation like that, what would you suggest that some of the things that families can do to support a suicidal or at-risk person on a day-to-day basis?
Well, I think some of the things that I was saying before about having permission to have an open channel of communication about it is really important, because I think that can actually it can help it feel a bit less burdensome to the people on both sides of the equation. And the communication is, and the sharing of information about it is pretty critical, really, because if the family member doesn't know, then they can't do the things that they would want to do to support. And supporting might be leaving the person alone for an hour. Supporting may not be hovering. The tendency would be because you'd be very concerned, the tendency would be to hover. But that needs to be negotiated. The right thing to do for a person might be that they just need a bit of space, and that needs to be respected. Unless, of course, you think the person's really at escalating risk or at very high risk, and that being alone means that they may have an opportunity that they wouldn't otherwise have. In which case, they really need to be receiving professional care at that point.
We've had a question here from someone who works with an at-risk person that experiences suicidal thoughts, doesn't have a plan, is actually kind of self-aware of this fact, and as a coping mechanism, this person will keep themselves very busy or concentrate on activities. Would you say that works as a coping mechanism? And that's
for some people, having some alternative distracting activities can be very useful. For some people, it may be something like going for a walk, which may not seem like a distraction from thoughts, but it's a physical activity which in itself can, in a sense, be a distraction. It can just reduce that preoccupation. But everybody's different in terms of what will be successful in that regard. And so again, that's something that sort of needs to be discussed. Of course, some people have a lot of experience of having these thoughts. And I mean, maybe this person that's being referred to here actually has developed their own mechanisms and approaches to managing their own suicidal thinking. And obviously that needs to be supported and respected.
What if you're a person who's experiencing suicidal thoughts or depression and you're ready to talk to your family about it? You talk to them,
yep,
and they don't take it so well.
Yeah. Well, perhaps I could talk, that's unfortunate. Perhaps I could talk first about how you might prepare to do that if you think that if you're concerned that people might not take it so well. You can understand why people might not take it so well, especially if it's coming completely out of the blue. They're probably going to be upset and worried. That'll probably be their first concern. I mean, almost without exception, families want to help other family members. They want to support them. So I have thought about some things that you could do. I mean, first of all, I think it's really important for the person doing the telling to feel really clear about why they're doing the telling. So, and you can then tell your family why you're telling them. So why is it important that they have this information? It might be because it's been going on for a long time and you've been seeking help and you just think it's time they knew about what was going on for you. In which case, that's a different scenario to a person feeling really desperate and wanting their family to help. You sort of maybe provide some sort of immediate help. So be really clear about why you're wanting to tell them, and then you can communicate that as well to your family members, because it gives them some guidance about how they might respond then. You may want to talk it through first with a friend or a professional, a health professional or counsellor, social worker, just to talk it through what different scenarios might be. Well, if my dad just really loses his temper, that's going to be really horrible. So what would I do if that happened? I mean, some people, and I've done this with one person where we actually role played.
Yeah.
And I had to pretend to be some different family members, and the person practiced with me. Yeah. So that they could just get some practice saying out loud the things that they needed to say.
And that's a really interesting scenario, because we did actually have a question from the other side of the coin, from a GP who was asking, how do I talk to my patient about how they might approach their family? So is that something that you would suggest to GPs perhaps as perhaps role play?
I mean, it might be a bit difficult for a GP because they have such a short time for their consultations, but it's definitely worth suggesting, because the person might want to practice with a friend or something.
Do you think maybe? I was just going to say though, because I often know that too, because I primarily see my GP with concern to my mental health issues, because that's the person with whom I feel most comfortable. So, would you suggest that either to either patients or to GPs themselves, suggesting that the person book, say, a back-to-back or a longer appointment if they're needing to discuss that? Yeah. Yes, absolutely. So being aware of that short time frame.
It is possible to do that.
Yeah.
Yeah, to book a longer appointment. But usually the receptionist would want to know what that was about. So you might want to do that by a phone call rather than waiting area. It depends
Yeah.
how it's arranged
Yeah.
in terms of just privacy. But can I just say, because I had a couple of other ideas
Sure,
about
sure.
how,
Sorry,
how
carry
people
on. Sorry.
might do this, because I think this is a really important question,
Mm.
and there's actually not much information about it. You can look on the internet for risk assessment and you'll get any number of hits, but there's nothing really much about this. Write things down. If you think that it's going to be difficult to sort of manage the conversation with your family, then it can be useful to make some notes about the important points that you want to get across to them, so that you've got that in front of you. Look, it sounds artificial, but it can be really useful. And sometimes I even recommend that people do this when they go to the doctor, actually, when they go to their GP. Or indeed, if they come and see me. Because sometimes, conversations go on, and especially if in this setting with the family, emotions can get a bit heightened, and people can lose to the track of the threads. But you're telling your family members for a reason, and it's important to sort of keep it anchored in that. So writing it down can be helpful. And the other thing is, you might want another support person to be with you. I mean, that's also another option. You need to make decisions about whether you'd want to tell family members one by one, or whether you want to do it in a setting where people are together as well. Now, that will depend on what your customs in your family are about how you communicate important information. So those are some things that I think are useful to think about.
Now, what about situations where you've got someone that really is on a roller coaster ride? They slip forwards and backwards. They might have made multiple suicide attempts across a period of time, say years. How does a family kind of stay strong in that kind of situation and keep the hope for that person?
I mean, that's really challenging, and I think you've hit the nail on the head there, that it's about keeping hope, because hope is absolutely critical. And hope not only for the family, but also for the person who's feeling suicidal, because it's that sense that there can be a more positive future is what gets many, many people through. And it's remembering the idea that suicide is essentially, it's a permanent solution to what is almost certainly a temporary problem, and trying to keep that perspective. So it's important for the communication within the family we've talked about, and that's obviously important. It's important that families feel supported by professional services, and that they feel that they've got access to that support. And sometimes that has to be negotiated. It depends on the service, and it may or may not be a mental health service. It may be some other health service. It might be a primary care provider. It might be a counselling service.
People might not might not find the best person the first time either, mightn't they?
That's right.
Yeah.
That's a really good point. They may not find the best person the first time, and it's important to keep trying, and not to just feel that trying to access the right services is futile. Because many people have told me, I've worked in mental health services a long time, and I've had lots of feedback about the futility of trying to get access to services. I will say that the people who work in mental health services in New Zealand are doing their best. Without exception, I think people are doing their best. And they work in a big, complicated system, and there's a lot to do, and it's really worth persevering from outside to try and get the support that you need. There may be other sources of support too, maybe church groups and other community groups, but it's important for families to set up their own support and not feel that they have to ride this roller coaster with the suicidal person all alone.
Sudden improvements. Someone seems really bad, and then suddenly the sun comes out. That can be a warning sign, can't it?
It can be a bit of a warning sign. It's a really tricky one, of course, because it's what everybody really wants. It's what everybody really wants for the person to feel better. If somebody who's been really troubled for quite some time suddenly feels better, over a period of a couple of days, and there's no apparent explanation for it, then I think you do need to view it with some caution and have that important conversation.
Someone's made the point here that consumers will often access family and whānau support services for their children, but won't think about actually accessing this for other members of the family. And these services are there for everyone, aren't they? These.
Oh, I see. Family whānau support services, not
Yes.
support from you. Okay.
Yeah, actually,
Yes.
it's services that are set up for this.
Yes.
Yeah.
Oh, yes, absolutely. I mean, those services are for everybody.
It's recognising that your own
any
needs
age.
as an adult are
Legitimate.
as legitimate.
Absolutely.
Yeah.
Your needs as an adult are legitimate. And, you know, if this is a long roller coaster ride, then, you know, it's important to have support that's going to help you to last the distance so that you can support your family member who's at risk. I just think that the most important thing in this is about feeling connected, and people who are feeling suicidal generally feel pretty disconnected from their relationships and you know, the people who are important to them. And if it's about getting over that hump, that feeling of it being really difficult to remake those connections. And so that's part of why it's important to try and talk to the people around you, the special people around you in your life. Even if it's just one person, I think making that connection is really critical for keeping hope alive.
You have been with Professor Sunny Collings of the University of Otago School of Medicine, and I'm Christopher Banks from the Mental Health Foundation. So thank you very much for attending this morning, and we hope we will see you again on a future webinar. Thank you.
Thank you.